Bismillah ar-Rahman ar-Rahim. How to differentiate between obstructive collapse and compression collapse. We can find the classical signs of collapse in a case of obstructive collapse of the lung lobe, and that signs include the following: shift of the trachea and the cardiac apex toward the same side of collapse in a case of obstructive 1, decreased lung expansion on the side of collapse in case of obstructive 1, dull percussion note on the side of the collapse, absent breath sounds on the side of the collapse there is, since there is no airflow through the obstructive bronchus. But in the case of compression collapse, the clinical findings are dominated by physical signs of massive thoracic lesion like large pleural effusion or thoracic tumor, which is producing the compression. So the trachea and the cardiac apex are shifted to the opposite side of the compression collapse. In case of a large pleural effusion producing compression collapse, some signs like tubular bronchial breath sounds and increased vocal resonance in the form of egophony may be elicited just above the upper level of the effusion on the posterolateral chest wall at the site of compression collapse. This is because the compressed airless lung tissue in that area may transmit the tubular breath sounds from a nearly patent large bronchus directly to the chest wall without filtration. And this entity is sometimes referred to as collapse with patent bronchus.